overview and new advancements in management of diabetes. So, diabetic patient who knows the most and applies it lives the healthiest and longest. This will be the outline. We'll go with some basics, we'll start with some basics, and we will end with future of diabetes management. So what is diabetes mellitus? It has two words, diabetes and mellitus. Diabetes means siphon through, and mellitus means sweet. Initially, the diabetes was diagnosed based on urine glucose. So diabetes is a chronic metabolic disorder characterized by high blood sugar levels which can damage the body from head to toe. What is the magnitude of problem? The problem is increasing day by day, and it is one of the fastest growing global health emergencies of 21st century. As you know, when you discuss with people in your family, so many people, they will tell you they have diabetes. And what is worrisome is that in the last 23 years, there's 4 times increase in numbers. Whatever is the projection made by International Diabetes Federation, the numbers are achieved 7 to 10 years before. Currently, 1 in every 10th adult is diabetic, 1 in every 9th adult is pre-diabetic, and 1 in 2 adult is undiagnosed with diabetes. And 1 in 6 live births are affected by hyperglycemia in pregnancy, mostly due to gestational diabetes. So numbers are worrisome, and we'll see why. And there are nearly 4 to 6 million deaths every year because of diabetes worldwide. How do we diagnose? Very simple, but still we'll just discuss. So people who are at risk for diabetes, age more than 30 or even younger, with family history of diabetes, having symptoms like more urination, more thirst, more hunger, family history of type 2 diabetes, sedentary lifestyle, being overweight or obese, high blood pressure, high cholesterol levels, past history of gestational diabetes in pregnancy, and history of polycystic ovarian syndrome. So these are the people who are at risk, and they should be vigilant, and they should keep checking frequently. How do we diagnose? There are 4 simple tests. These questions we very commonly being asked, that what is the level of sugar to become diabetic, and sometimes people are confused. So we have 4 tests: fasting plasma glucose, which measures blood glucose in the morning after overnight 8 hours of fasting. Then oral glucose tolerance test, in which we give 75 grams of glucose and we check the glucose after 2 hours. HbA1c, which all of you know, and random blood sugar if associated with symptoms of high sugar. So HbA1c more than or equal to 6.5, fasting plasma glucose more than or equal to 126, oral glucose tolerance test 2-hour value more than or equal to 200, and random plasma glucose with classic symptoms more than 200. What are the types of diabetes? This is a very frequently asked question in our clinical practice. A lot of time people don't know whether they are type 1 or type 2. So type 1 diabetes is secondary to autoimmune beta cell destruction of pancreas, leading to absolute insulin deficiency, and these patients are dependent on insulin throughout their life. This usually happens to children less than 20 or elderly people more than 60 years of age. This is a variant of type 1 diabetes which is known as 1.5 or LADA, which is latent autoimmune diabetes of adulthood. Here, these people may respond to oral medication in the beginning, but eventually the oral medications they fail and they need insulin, like for people with type 1 diabetes. Type 2 is the commonest type of diabetes. 90 to 95% cases are due to type 2 diabetes, and the driver for development of type 2 diabetes is the insulin resistance. When this is coupled with progressive beta cell loss, then the diabetes is manifested. Insulin resistance is the first and the key defect in development of diabetes. And this results from obesity, inactivity, genetics, aging, medications, and some rare disorder. It gets manifested not only in form of diabetes, but it can get manifested in form of PCOS also. Atherosclerosis, people with insulin resistance, they are at high risk of development of heart disease, dyslipidemia, and hypertension. The insulin resistance triggers the development of diabetes high blood pressure and high cholesterol in people with diabetes. So that is the gestational diabetes, which comes during pregnancy, and it goes off after pregnancy, but 50% of patients may become permanently diabetic within 5 years if they don't take care of themselves. Then there are some other uncommon type of diabetes which runs in families, like monogenic, less than 25 years of age, and then sometimes some medications, they cause diabetes, most commonly due to steroids. So what is the current status of diabetes control? As we say that in majority of the patient, the HbA1c should be less than 7%. In younger people, we target 6 to 6.5, and in elderly people, 7 to 7.5, as per their overall condition. In developing countries, if you see, the current numbers are shocking. Less than 50% of the patients are on HbA1c of less than 7%. So think about the developing, this is from developed countries, sorry. Think about the developing countries. Now if you see the numbers here, 30 to 40% of diabetic patients in UAE have HbA1c of less than 7%. Only 1/3. Now if you see the association of HbA1c with different complications of diabetes, 1% reduction in HbA1c can bring down the risk of complications significantly. With 1% reduction, you can see 21% reduction in diabetes-related deaths, 14% reduction in myocardial infarction, microvascular like heart disease, kidney disease, eye disease, nerve disease can be reduced by 37%, and amputations or death can be reduced by 43%. The main objective of treating diabetes when it is diagnosed is to give a good control, to have a good control HbA1c 6.5 to 7, because that builds the good glycemic memory or metabolic memory. That means your cells in different organs, they remember that your body is having good control and the complications can be prevented in next 20 to 30 years. That is why we say that first 5 to 10 years after the diagnosis is the golden period of diabetes. So if you control all the risk factors, including lipids, high blood pressure and sugar, then you can prevent most of the complications. What are the common complications of diabetes? We have world-class experts to discuss that today. So let me ask you one simple question. What is the commonest fatal complication of type 2 diabetes? Yes, heart disease. Now, what is the most embarrassing complication of diabetes? Erectile dysfunction. So, the good news is that 80% of the time complications can be prevented if you practice and if you control diabetes, blood pressure and cholesterol. And you can see the cardiovascular disease, eye disease, kidney disease, neuropathy, or nerve disease, everywhere diabetes is the leading cause. And every 5 minutes, someone with diabetes suffers from heart attack, and every 30 seconds, someone loses a limb to diabetes. But you can prevent the complications. Sorry for that. Another creeping problem, which is increasing day by day, is the fatty liver disease. And many people are ignorant about this is becoming one of the common cause for end-stage liver disease and liver cancer. And you can see here, nearly 8%, up to 8 to 10% of patients, they develop end-stage liver disease or liver cancer over a period of time. So what is new in treatment of diabetes? So we'll see what has been changed in the approach in treating diabetes. The newer insulin, newer medications with benefits, and then continuous glucose monitoring device, cell therapy in form of islet cell therapy, and stem cell therapy, and how can we prevent type 1 diabetes in people who are at risk for it. So this is from American Diabetes Association, standard of care, which usually we follow. It gets released every year in December and January. So The groundbreaking research in last 10 years has changed the landscape of management of type 2 diabetes. The management of type 2 diabetes is no more glucose or sugar centric. So don't just focus on glucose. We have to, the management is cardio, renal, metabolic and weight centric. That means besides controlling sugar, we have to maintain weight, we have to reduce the risk for heart disease and kidney disease. And these are the 4 pillars of diabetes management, where the glucose management, blood pressure management, cholesterol management, and choosing medication which protect your heart and kidney. But if you see here carefully, the weight reduction is at the helm of it. Because weight reduction is the single most factor which can impact all the 4 pillars favorably. And that is why the emphasis on weight loss has been given so much in the newer guidelines. So the ultimate goal of treating diabetes is to prevent complications and reduce the risk for heart disease, providing good quality of life. So the newer medications, we just go in short. There are 3 new classes which have changed in last 10 years the management of diabetes significantly. So the first one is the SGLT2 inhibitors, and these are the medications which many of you are taking. They work through the kidney. As you know, in diabetic patient, the kidney filters a lot of glucose and it reabsorbs it, which goes in the blood and increase sugar. These medications, they reduce the reabsorption of glucose from the kidney and they make glucose excretion from the urine and they reduce the glucose level in the blood. They have beneficial effect on heart, kidneys, they help in losing weight and they help in controlling blood pressure also. They must be used in people with type 2 diabetes who have heart disease or heart failure or kidney disease or who are at risk for development of these problems or if you have high urine albumin. But everything comes with price. The side effects, we have to be careful. The 2 main side effects is the infection of the urinary tract. The second is the genital mycotic or fungal infection. But most of the time it is preventable with good hygiene and with good hydration. Now, these medications should be stopped if you are acutely sick or if you have any condition which is leading to fluid loss or if you are undergoing for any surgery. The second category of newer medications is GLP1 receptor agonist. When you eat your food, there are gut hormones which are released from your gut and they control your blood glucose after food. And these gut hormones, the secretion is reduced in people with diabetes. And these medications, they provide the higher concentration of those gut hormones so that your sugar can be controlled. Now, besides controlling the blood sugar levels, they have myriad of different benefits. They protect your heart, they protect your kidney, they help you in losing weight, and they help you in controlling blood pressure. So they must be prescribed in people who have heart disease, are having high risk for heart disease, are having kidney disease. The main side effects are nausea, vomiting, diarrhea, or constipation, and these medications are not suitable if you have severe gastric problems. Now, if somebody is having history of pancreatitis or having some type of thyroid cancer, then this should be avoided. The major limiting factor is the cost. So they can protect your heart and kidney also. The third class, which has become the talk of the town, everybody is coming for Mounjaro. This is Mounjaro. It's a dual GIP and GLP1 receptor agonist, which has surpassed the benefit of GLP1 receptor agonists, which we discussed in the previous slide. And they work on your pancreas, fat tissue, liver, and brain. They improve all these organs' metabolism. They reduce appetite. They increase satiety, and they slow gastric emptying. The beneficial effect is on not only on the sugar and liver, but they can lead to up to 20% of weight loss in people with diabetes. Phenomenal weight reduction. and blood pressure reduction too. Main side effects are again nausea, vomiting, diarrhea, and constipation. But they should be avoided if somebody is having history of pancreatitis or having some family history or past history of medullary thyroid cancer. Again, cost is a major limiting factor. So the 1921 was a landmark year when the insulin was discovered. It was a life-saving drug, and this was the first patient who received insulin, Leonard Thompson, and lived up to age of 21. He died of pneumonia. Before that, most of the people of type 1 diabetes, they were dying. Sir Frederick Banting said that insulin is for the world, and he sold the patent for $1. The commercial production started in 1922, and they were very cumbersome vials and big needles and all. But the discovery of insulin came with the price of hypoglycemia or low sugar. So after that, scientists have constantly strived for the better and better insulins which can reduce the risk of hypoglycemia significantly, and we are really fortunate to have the insulins like Gargin and Icodec, which have very, very minimal or low risk of hypoglycemia. These are long-acting insulins. And now, the once-weekly insulin is approved by FDA. And very soon it will come, it will make the life easier. And there is another fast-acting insulin, which is Fias, especially for this subcategory of type 1 patients. Despite having all these, there's ample room for further innovation. And you can see here that hopefully we'll get someday oral insulin also. And then glucose-sensitive insulin, and the future is the stem cell therapy. Now this is one unique thing, which is unique medication, which has been approved in 2022 November. As you know, the people with type 1 diabetes, their siblings or relatives, they are at high risk of type 1 diabetes. And they should be screened for type 1 diabetes. So this medication, teplizumab, is the first drug which is approved to delay the onset of stage 3 type 1 diabetes. And this is approved for people aged more than 8 years with a stage 2 type 1 diabetes, where 2 or more autoantibodies are positive, and there is slight increase in glucose, not to the level of diabetes. So IV infusion for 14 days, 50% of people may be without insulin for next 2 years. Next comes the continuous glucose monitoring, and this has also revolutionized the management of diabetes. So we have different types of sensor. The most commonly used ones are the Libre 2 and the Dexcom 6. Now they can monitor the glucose continuously without pricking, and you can monitor as many number of times, and this helps you in controlling your sugar, your food intake properly. Another major thing which is going to hit the market soon is the Eversense implantable sensor, which will be implanted in subcutaneous tissue for 6 months, and it will keep on monitoring your sugar. The next comes insulin pumps for the people who are having type 1 diabetes, brittle diabetes, and type 2 who are on multiple doses of insulin. So this has 3 components usually, just to give you a brief idea about it. This is the pump, inside is the infusion set, and this is the sensor. So sensor sends the glucose, it sends the signal to the meter, and you see the readings on your mobile, and then the pump delivers the insulin. The rapid acting analog is the most commonly used insulin. We have 2 types in this, auto mode. Usually auto mode is preferred because it calculates the insulin by itself by putting what you have eaten. Hypoglycemia alarm is there, which suspends the insulin if the sugar is going low. It can improve the quality of life, reduce the risk of hypoglycemia. The cost is the major limiting factor. People who are committed to use this, they should be advised. And for the people who have difficult to manage diabetes, pregnant women, brittle diabetes, recurrent episodes of low sugar or hypoglycemia, they are eligible for that. Now this is the new thing, which is bionic pancreas. As in the previous one, we've seen the insulin pumps. The insulin pumps, they do not have glucagon, which is required to counteract low sugar. So bionic pancreas has included the glucagon also. So the loop is complete. So you're controlling the sugar, and if the sugar is going low, the glucagon will be delivered and it will counteract the low sugar or hypoglycemia. This has been approved this year only. It has, again, 3 parts and more than 6 years of age. Where its cost is a factor, in coming years it may be a reality. So next we come to the islet cell transplantation or stem cell therapy, because everyone is curious for the cure of diabetes. So it is mainly at present for the brittle type 1 diabetes. The success rate is still only 32%. In 5 years, people will be insulin free, 32%. Now the main problem is the supply of islet cells, and that's why scientists are working on porcine islets or the stem cells. Main challenges is the rejection, and they need therapy to suppress the immune system to prevent the rejection of this. The stem cell therapy is a lot of research is going on. The main challenge is the chances of rejection. So they are using now encapsulated stem cells in subcutaneous tissue. So they will resist the rejection and will be successful. The commonest site is the liver or for encapsulated subcutaneous tissue. The main challenge with stem cell therapy is that non-islet cell proliferation. You want specific cells to proliferate. Sometimes non-specific, non-required cells, they get proliferated, and sometimes they can get malignant or they become cancerous. So very soon it will become real. So what is the future of diabetes management? Future is bright. We have more potent and oral injectable therapies in pipeline, which are going to which will bring weight reduction significantly, bring down the weight, and will improve the overall profile of diabetic patients. Islet cell transplantation and stem cell therapy may become reality in coming years. Prevention of type 1 diabetes in high-risk people is becoming widespread reality. Smart insulin pens are going to hit the market, which will calculate the carbs, which will remind the patient to take the insulin. Bionic pancreas may replace conventional insulin pumps. Better and smaller glucose continuous glucose sensor will make life easy. New glucose watch may be approved soon. Non-approved ones are available. Inhaled glucagon is approved by FDA in July 2023 for people aged more than 4 years for severe hypoglycemia because they cannot take anything orally. So I'll end with this. Doctor, you already have a pill to reduce eating. Can you give me a pill which can make me do exercise? So don't worry, they are working on it. There will be a pill you will eat. Without doing exercise, it will give you the benefit. So, ABC of diabetes management. Fundamentals. Again, if you master them, you can prevent the complications. Glucose control, blood pressure control, cholesterol control, healthy and balanced diet, exercise, and regular follow-up with your teaching doctor. Thank you very much. Thank you.